adjust the camera a little down. Yeah, perfect.
Muskan, are you ready?
Laptop.
So actually, Arushi will start with the beginning, and I'll commence the meeting. So Arushi will start.
Whoever is starting, let them start. 6 o'clock.
5:59 in my.
Arushi, you can start the meeting.
Am I audible?
Yes.
Yeah, audible.
Hi, Arushi.
Yes, sir. Sir, actually, the AV Tech team has not yet joined. So I was actually waiting for them because they had to play the video.
Yeah.
Okay.
So once they
Hello?
join, you can start.
I already
Yes.
joined, ma'am.
Somebody from Gosumec Alumni Association.
Yeah. We are sharing the videos, ma'am. We are already joined.
Okay.
Okay, sir.
We are ready.
Sure.
The students loved your interview, Dr. Anil. Hello.
Hello.
Anil, am I audible?
Sir, you're audible.
No, I was communicating to Anil. So, anyways, once you're ready, you start. You're just trying to bridge the gap.
Okay.
Arun is specialized in clinical research. Arun started an association for clinical research. He is pioneer in India, and he is very proud that he has inculcated ethics and all the good things in clinical research, which I'm sure this M.L.Kothari Humanities will be very proud to have Arun in the meeting. Arun, would you like to say something related to M.L.Kothari and Humanities? Please.
In fact, to say M.L.Kothari is actually to me a little bit odd because we know him as Manu Bhai. And even
So
the
that
word
is, I was calling him M.L.Kothari because for the students to know.
No, I know, but I'm just saying they should know that it's fondly we call him Manu Bhai, although we know he was our teacher, Dr. Manu Bhai, very brilliant person. And we had a chance to meet him personally, as a teacher, as an examiner in Viva.
Ravi also had joined. What a pleasure.
Hi, Ravi.
Hi, Tambi.
He's muted.
Ravi, as usual, you are in a dark room. Their radiologists are more active when they are in dark.
But he's not radio opaque. He's visible.
Okay, you can sit over here. Ravi, unmute yourself, please.
I'm unmuting.
Yeah.
Hi, Ravi.
Hi, Ravi.
Hi.
What a pleasure.
My
Real pleasure to see you. Arun is seeing Ravi after how many days? How many years?
Oh, Ravi, I met him in that
Conference, is it?
No, Ravi, I met you at the hospital, no? When you were recovering and then obviously.
Oh, that is long back. That is history. That is history.
No, then even I met him earlier also.
I met Ravi a month back for that prize distribution of.
I know. You shared the picture. Yeah, you showed the pictures.
He said prize distribution. He didn't say that he got the award.
That we
Hopeless fellow.
No, Ravi, we know that because
He's pretending to be modest, huh?
No, Ravi, you are not in the WhatsApp group, but we have done enough celebration in the group when he got the award. So
you know why I'm not in the WhatsApp group?
Why?
Because Ambi. You know who is Ambi?
Don't worry about it. I mean, you can choose to remain quiet.
You don't know. You don't know. He'll give me gala in Tamil.
We will immunize you. We will immunize you. Don't worry.
No.
Excuse me. Sorry.
Yes. We are all waiting for you.
We can start the meeting. Arushi,
May I start now?
Yeah, please start.
Okay, sir.
Mobile.
Okay, so first of all, a very good evening to all the respected participants.
Good evening. Is that Arushi or?
Yes, sir, this is
Muskan?
Arushi.
Or Muskan?
This is Arushi.
Okay.
Arushi.
Yes,
Hi,
sir.
Arushi.
Hello, sir. Good to see you again.
Hi.
Yeah.
Yeah. And I welcome you all to the virtual reunion of the GSMC MBBS batch of 1971. So, before we start, there would be a small video of medical humanities which would be played. If
Yeah, go ahead, go ahead.
yes, sir, the will be played by the Gosumec Alumni Association.
So
If
you
you could
order
please,
them.
no, sir. Yes.
Yeah, they have started sharing.
Yes, yes.
They may please increase the sound.
Okay. Thank you very much, sir.
That was
So,
really beautiful, and I'm seeing it for the first time, and my compliment to whoever made it. It's really beautiful.
Nice to see Suresh Khilari.
Hi.
Suresh Khilari stays and practices in Chembur. Suresh, thank you very much. We
You're
have got
muted.
a massive attendance of four classmates.
You are muted. You are muted. Suresh.
And from expected 2, we are 4. So it is 100% more attendance.
I know.
Suresh, you can unmute yourself.
Anil Tendulkar tries to mute himself, but the microphone does not allow it.
Suresh, you are in India or which part of the world are you now?
I'm in India.
Oh, back.
Otherwise, it would be 5:30 in the morning.
On a Saturday.
It would be 5:30 in the morning. Those West Coast people, it would be 5:30.
Okay.
So it is difficult for us to get them, I think.
Forget about. So if you try to please everybody, you can please nobody. Anyway,
Yeah.
back to Arushi or Muskan. Go ahead with your agenda. You want
Yes,
to
sir.
ask
Yes,
same
sir.
questions to these three gentlemen. You may please ask. All three are extremely witty.
Natarajan is the supervisor. What? He's looking after everybody.
He's going for a wedding and trying to get into our meeting. No, that's
I
the
know.
problem now.
I hope he's not driving.
No, he's in a vehicle, looks like.
I know. Yeah. He is.
Yeah.
Who is the master of ceremonies here?
Yes,
Swarupa?
Arushi. Come on, go ahead, Arushi.
I'll go
Arushi.
ahead, sir. Okay, sir.
Yes,
Yeah.
You can
Okay,
start the interview.
there's a few words we would like to say about this initiative, GOSUNION. So, as we all know, that our precious Twin Institute was established in 1926, and it will be completing its centenary in 2026. So, we would like all the batches to have a memory to look back to and cherish these precious college days. Hence, it is our mission to reunite all of the batches. This gave rise to the initiative of GOSUNION. So now we would like to share a PPT about the Gosumec Foundation. So, hello. Gosumec Foundation was established in California, US, to give back to our alma mater, which has helped so many professionally and personally. This website allows you to enjoy nostalgic content, including the history of our institution, medical humanities, archives, etc. So this first slide is showing the web address of Gosumec, and at the footer of the website, there are links to social media accounts, including YouTube, from where you can access all of these virtual reunions. And then next slide. Yeah. So this slide is showing us the mission of Gosumec Foundation. So the mission is to connect, contribute, and engage. So connecting the global Gosumecs with our alma mater, contributing to alma mater's development by sharing the 3 T's, that is time, talent, and treasure, and engaging the Gosumecs with nostalgic media and enabling global network. Okay. Next slide. Okay. Previous slide, please. Thank you. So then this slide is also showing us how to access the Google form. So most of you may have already filled the form from the link if it was circulated in your WhatsApp group. So then the objective is to connect with each other and the alma mater. Gosumec Alumni Association, which is the official alumni body at GS. And this information will be secure between the Gosumec Alumni Association and the Gosumec Foundation, would later be used to create a secure and searchable database. So we are looking forward to Gosumec supporting the mission to connect, contribute, and engage.
Arushi, can you go back one slide, please?
Okay, the previous slide. Yes, this one.
Please connect, contribute, engage into contributing into bracket 3 T's.
Yes, sir. So the
Manu
contribution
Tendulkar.
is. Sir, actually the 3 T's are time, talent, and treasure. So they are basically
Okay.
talking about the contribution,
Contribute
like
any
giving
one
back.
of the 3 T's.
And I thought 3 T's. I thought
Anil, between you and me, we can.
morning tea, evening tea, and high tea.
But Suresh, between Anil, you and me, we can finish all the 3 T's, no? Tendulkar and double T.
Yeah, bad tea.
Okay, let us not
Digress.
give little tension to Arushi and
No, sir, it's okay, sir.
yes,
Okay.
Arushi, what is the next?
Yes, sir. So before we play the interview, a few words about Dr. Anil Tendulkar. So Dr. Anil Tendulkar is a renowned cardiac surgeon.
Baba, they
and
all
he is
know.
some-
They will be bored. They will straight away log out.
No. See, I had denounced cardiac surgeon.
Renowned, yeah.
Arushi,
Yes.
we all know each other's horoscope also, or a horoscope.
Okay, sir.
I
So
thought
then,
Vinod
Just
said it only.
skip that, please.
okay, sir, we will skip that.
If
Now
you
we
want-
would be
If
playing
you
the
want,
interview.
introduce Arun, Ravi, and Suresh Khilari. Arun, but as I already mentioned to you, all of you, he did MD in medicine, but he took a lot of interest in clinical research, and he is considered as a sort of a father of clinical research, ethical research, clean research in India. He is an editor on a number of journals, and I think, please correct me, you are medical director of Arun
Novartis was.
Novartis.
Yeah, was.
Yeah, and Ravi is considered as father of radiology all over India. And moment they ask me, you are from which institution? If that person is a radiologist, moment I tell them Ravi's institution, immediately the respect for me increases leaps and bounds. So Ravi is like absolutely dedicated radiologist, and Suresh Khilari, though
I'm the father of only 2 daughters.
two daughters officially, let me put it correctly.
Hello.
Everybody.
क्या चालू क्या है?
So Suresh Khilari, Arushi and Muskan, if you are around, though he's a general practitioner, he is a great table tennis player of our institution, and he represented our institution. He's really from name Khilari. He's a player, and he represented our college at all levels, and even today at the age of 70, he plays table tennis and keep himself absolutely fit. And he does swimming also, am I right?
Yeah,
Huh?
yeah.
Yeah, because of swimming, his hair all have washed out. Side effect of swimming. So, Suresh Khilari used to give a lot of stress to everybody else. He used to indulge in playing cards whole night. Arushi, this is for you. He used to play cards whole night in hostel, and in the morning when he is climbing up the stairs, if somebody asked him, "Are Suresh kidhar tha?" He said, "Doing cardiology." So all the GSIs, second floor lobby, third floor lobby used to be under tremendous stress. Person like Suresh Khilari whole night doing cardiology, that was, then he used to come and have a hearty laugh. We were batchmates in third South and used to have a hearty laugh, Suresh Khilari. So that was about all my my 3 friends, I won't say colleagues, more friends over here. Ravi was my colleague in KM when we were together, one heading the cardiac surgery and one, I was not heading the department, unit chief, and of course, Ravi was heading a huge department. I don't know whether he knows how many staff members he had in the department. So that must be a puzzle to him even today.
Yes, to scan them. Yes, to scan the number.
Yeah. Yes, Arushi, what is your next question? Ask all those questions to these people.
Anil, 1 second. Arushi, that gives me an idea for the celebration of the centennial. You have matches of various sports between veterans and young Turks. There are people I know who play badminton, who play table tennis, who play basketball. So you have some events where you say people over, say, 50 years of age or 60 years of age have a cardiologist standby and the young GS students. That would be fun.
Cardiologist and ICU both stand by.
ICU to hai na.
Beds to be kept vacant. Orthopedics, girl physiotherapists, physiotherapists to be available.
And are we playing? Yeah. Are we playing the sports with the ECG monitors on?
Yeah, stress test.
Whatever, I mean, jokes apart, that's an idea. I mean, you can have them voluntarily cleared by the medical exam and then come and play whatever you want to play. That would be great. Against an age limit. Yeah.
Yes, Arushi, next agenda.
Yes, sir. So we would be playing the interview now.
Okay. And they are allowed to comment in between, or
Yes, sir, of course.
Yes,
Yes, sir.
yes.
can you stop the interview in between? Pause it?
Yes, yes, we will pause the
Good.
interview.
Anil, we want to hear more of the interview than your voice, huh? Beach
Yes,
में बोल मत.
It's my interview. I'm trying to immunize you.
I know.
Yes, please start, Arushi.
Dear Dr. Anil Tendulkar, sir, greetings. We at the Dr.M.V.L.Kothari Chair and Division of Medical Humanities firmly believe in preserving our history and making it accessible to all. To that end, we have recently organized a lecture series on the history of medicine. We now seek to move on to a more ambitious goal to record the history of St. J.S. Medical College and KM Hospital as told by its alumni. Much can be said about the history of our esteemed institution itself and of all the great men and women who have worked and taught here. In addition, we wish to record the experiences and fond memories of all the students who had studied at St. J.S. over the decades. We would like to ask you a few questions. So, the first question is, what was the structural layout during your time in KU?
First of all, I was at KEM from 1971. I joined as a first MBBS student until 1999, when I was transferred to Lokmanya Tilak Memorial Hospital as head of the Department of Cardiac and Vascular Surgery. So, during our time in 1971, when we joined as students, there were less number of buildings and more amount of space. For example, this library building was not existing, and the multi-story building was not existing. In fact, this building where this entire interview is being recorded is a surprise to me just now when I entered this building. So understandably, because we had, during our time, 140 students were enrolled.
160.
120,
160.
but Dr. Natarajan gave me a full
160.
protocol of 140 students. So less number of
160.
students, everything was
Okay, correction.
number. So I don't want to criticize that this too much. Now, when we visit KEM, everything looks too crammed up for people like me. So that was the basic layout, that we had college building, then the KEM being all that you see in stone was existing. This boys hostel, which you call main boys hostel, or just the boys hostel. And then we had professorial quarters over here, quarters for servants, and then all along the periphery, there were old style of quarters. We used to call AO quarters. I don't know what is the name. And when I joined in 71, this 5-story Arema hostel, new Arema hostel was built, called Old Arema Hostel and the New Arema Hostel. And there was a small staircase between third floor and the second floor of New Arema Hostel. And a typical medical style, we used to call it fistula. So, because the New Arema Hostel had a lift and the old Arema Hostel didn't have a lift. So it was very common for a tired RMO to come by lift to third floor and through fistula to come to second floor. And we had a RMO room. Bharti, my wife and me were staying as we were senior residents that time in room number 305 next to the fistula. So always somebody will always peep in and ask, Bharti, what are you cooking? Bharti, what are you doing? And there will be always somebody in our room either eating or chatting. So that was the general layout.
Okay, thank you. The next question is, what were your experiences in the dissection hall and labs, as well as in the wards and your encounters with the patients?
Do you want to pause now, Arushi? Yes,
Suresh,
Yes.
Suresh,
Yes, sir.
I want to
Suresh,
correct Anil.
Ravi.
There were 160 students, not 140.
Okay, mistake. Sorry. Anything else you would like to add about
No,
layout?
thank you.
Arun, Ravi.
I think there is one part of layout which probably is still, I think, mystery to us, and we used to always wonder. I don't know if Anil mentioned. There used to be toilets opposite Dean's room. Unfortunately or
That
fortunately.
is coming little later.
No, but I didn't know that, so I said, let me start with that.
No,
We
that
used
is
to
coming
always,
little later.
so we used to always wonder where we are going. Are we going there or here? And very often the deans were, will you see, sometimes they were so strict. So I think people used to go in and go to the other place. Immediately looks like. But that is one memory I remember. And now, of course, it shifted further on. And obviously, the classes were, I think, I don't know, were classes or only the structure, no? Because I only remember the buildings right now we have to go out, no? The most popular building was, of course, the canteen building, which was little away from us. And we couldn't afford to go there, but we still used to go there to see what is cooking.
Ravi.
No, I was just saying that I completely agree with what you said about crowding of the KM. I go to KM at least twice a week for something or the other. And if you walk along the periphery of the hospital, it is really heartrending. The amount of human suffering has increased much more only because there is no place for people and patients to stay. So I talked to one of the deans the other day, some years back, some months back, and I asked him, why is this so bad? Why is this happening? Why are patients standing in crowds which are half a kilometer long? And he said, Ravi, you tell me what to do. I will do it immediately. So that is their problem. And these problems are have no real solutions. I mean, all of you, if you go to KM, that is what will strike you. Even for me, who goes frequently KM to KM, the changes are much, much worse. But if you get into the medical part of it, it's a different ballgame altogether.
Yeah,
Anil, that's all I have to say. Yeah.
Just to add something to what Anil said, one day I was at Tata, the new building, and I went to 13th floor. I was taking a class for students and waiting for they had not yet come. Then I looked out, I could see the whole of KM from there. The most beautiful view I could see from there, and I made a picture and posted in my group. But that time I realized that what is this KM? A bird's eye view from above. So nobody can go above KM, but I could go above physically and see. So that time I could see the KM which I entered and KM which exists today. I think there's a lot of structural difference, but yes, the parts which we still relish are there, and it's a great memory. The buildings are probably not going to change, but we have changed and we still relish the old classroom. When I go to MLT, I still feel that I'm sitting there somewhere in a corner, not dozing off.
Arushi, I don't think you should get the wrong idea that we are criticizing what's happening now. As Anil said, it is just a recap. What it was then, and then we tend to compare it with what it is now. So it's our KM. We cannot criticize our own KM for anything. Yeah? Okay.
Arushi, go ahead.
Experiences, there was a nice sentence in the anatomy department. I don't know whether it still exists. I'm sure it sure exists even today. That the old adage that dead bodies tell no tale doesn't hold true here. Little high level M.V.L.Kothari level English. But
yeah,
it means
Anil,
that
it's all still there.
this is a
Everything
place
still
where
there.
dead bodies tell you everything. And I'm very proud. We were a group of dissection partners. Now they are still distributed at random. You choose your own partner or you are told.
Yes, sir.
During our time, that was a very nice practice to make us feel friendly. We could choose our own partners. And we were 4. That means I had 3 very wonderful partners. Suhas Prabhu, Kishore Nadkarni and Kishore Padke. Kishore Padke was my schoolmate from King George, right from 1st standard. And these other 2, Kishore Nadkarni and Suhas Prabhu, were his Ruya College mates. You know Ruya College. So during our time, Ruya College was one of the top colleges. So we were 4 dissection partners. So we were told to have your own partners, and then you have to go and tell. So our roll numbers were not according to initials. Roll numbers were according to the way we declared that, well, we 4 will be the partners. So that helped us in not getting scared of the medical college atmosphere. So we had a very wonderful time in dissection room. We used to do very serious dissections, and I feel that helped me a lot in long term. And we had another department, Dr. K.D. Desai, is to stroll in the corridor of the dissection room without uttering a single word. And that used to be a very imposing figure, Dr. K.D. Desai. He was the head of the department that day. So that was very imposing upon us. So not that because of him we did sincere dissection, but we loved dissection, and we did, and it was we were very proud to see how I have dissected median now completely cleanly, how I have dissected medial now, or some dissection in the neck. So it was really very happy moments in Department of Anatomy. Perhaps because of that, and of course partly because of Dr. Lopa Mehta, I conduct fun quiz in applied anatomy. I don't know whether it was conducted during your, well, it was conducted before COVID. Then during COVID, because of COVID, there was a gap, and I'm happy again this year I conducted one again. So open book quiz. So I'd give them a clinical situation, describe it in detail, where heart surgeon cuts and where heart surgeon takes stitch in detail with pictures. And a student is asked to tell why I cut it here and why I did stitch here, like that. So that student should know the anatomy. So that love for anatomy continues from them, from that time.
Anil, I want to say something
And
about
sir, how would
dissection.
you
Rushi, can you pause, please? Ravi wants to add.
Yeah.
Ravi, go
There
ahead.
are some things about dissection which are extremely important, and one is that, I don't know, Anil, about you, we dissected without gloves. I mean, at the end of the day, the hand will become somewhat crumpled because handling formalin, and some of you might find it astonishing that we dissected without gloves, handling everything without gloves. As far as my obsession with dissection was concerned, I tell my students even today that I can remember where the sural nerve is, where the cisterna chyla is, how the pulley of the superior oblique is, because we dissected and dissected and dissected. And do not misunderstand, I'm a time bram. I took the brain in what was then called a dalda dabba, put in formalin, I took it home and I dissected at home. I was obsessed with brain dissection. And my mother said, I will not come into this room. So many of us, like Anil is saying, were obsessed with dissection. It's extremely unfortunate. And this has to be said, that the students I come across, now we are all top in the NEET exams, they have very, very little knowledge of anatomy. And as Anil said, like cardiovascular surgery or any surgery, radiology cannot be practiced if you do not have knowledge of anatomy. So Nattu is here. He must be really checking after what the students are doing. I think you have to create a passion of dissection. You cannot force it down. And what you learn in dissection stays with you all your life. I mean, there is no way you can forget what you've seen with your own eyes after dissecting. And Anil said so beautifully. Dissection is prime. I don't think you can learn it by 3D models or videos, wear goggles, you do what you want. But the actual doing the dissection is something that stays with you all your life. Okay, I'm done, Anil. Harushi, please carry on, unless.
May I say something? I think
Arun, yeah.
I want to go back to know what you started with, know what the department looked like. And I remember since Dr. Kothari is the kind of, I think, the soul behind this activity. I recollect even in those days, no, there used to be a Gujarati poem written on his blackboard. And I was amazed that a doctor, anatomy professor is writing Gujarati poem. I don't remember the poem, but I remember distinctly every day there will be a poem. And there was one quotation which was put up there very often, or maybe once, no, by Will Durant about no democracy. Democracy without education is hypocrisy unlimited, some such thing. No? So those two things are in my mind that no, this idea of no philosophy in the anatomy was kind of put up by Dr. Kothari long back. No? Obviously, the other part, as Anil and Ravi said, yes, we did this section, but this section, no, he's kind of stayed with me forever. That there was something beyond the dead bodies and the anatomy, and we learned more for the future, because as I mentioned, more than touching the patient, are you touching their soul or heart? That's what Dr. Kothari seems to be kind of asking us.
Suresh?
Okay, so much has been said. Yeah, I only remember Mithabai.
Very important person, very important person.
Can you explain to Arushi who Mithabai was?
On the dissection side. Okay, Arushi.
How was your experience in going to the wards and attending clinical postings or your communication with the patients?
The experience was always pleasant, I may say. So the main reason for that, I give credit to the passionate teachers which we had. We are very fortunate to have passionate teachers. And not necessarily by passionate teachers, I not necessarily mean professors. Even the registrars, everybody were extremely passionate in teaching. There was one Dr. Jaikar, he unfortunately met with an accident and he died.
Not accident, not accident.
These were all registrars.
Just, I didn't want to tell in detail about, I am fully aware what happened to Jaikar. Pardon me for editing purpose. Yes, Arushi, go ahead. Can you go back a little bit and start again?
No, continue, it's okay.
In today's language.
For link purpose.
No, it's okay, it's okay.
Just couple of millimeters back. You can.
With an accident and he died. Then Kashyap. These were all registrars, that residents, in today's language, residents. But they were passionate. Forget about great teachers like Dr. G.B. Parulkar, Dr. Ravi Bapat. In Department of Anatomy itself, we had one Dr. Ramesh Rege. His photograph used to be there in Department of Anatomy. Ramesh R.V. Rege, if I remember right. So extremely passionate. Moment one student approaches him, you start asking him, tell me this, tell me that, tell me 4 batches, tell me this importance. So you don't have to request him to teach. So extreme passionate teachers we had. Dr. Sharadini Danukar in pharmacology. So there used to be night classes. I don't know whether they are now takeless or not. And we never had to search for any tuitions in medicine. Then Dr. Bapat used to conduct classes on Sunday morning. Ravi Bapat. So he used to conduct class on Sunday morning. And his brother-in-law, Sudhir Joshi, was my very close friend, schoolmate, and my room partner. So as a second or third MBBS student, we used to sneak and attend those classes. On Sunday morning, 9 to 1, 4 hours. And all I aim was grilling. And what Dr. Bapat got? Nothing, not a single paisa, not a single rupee for that. And those classes were crowded. It is not that nobody was there. Classes were crowded. Then there was one Dr. Darayas Hormashi in orthopedics. Classes were legendary. Dr. Ellen Vora. So these are the people who wanted to teach you everything. How to stand, And days to clueless is we used to go with the idea that we will be,
Anil,
if
I
you
want to
allow
say,
me to use the word
I want to say
screw.
something. Anil, I want to say something.
Yeah,
Anil?
Arushi, please. Yeah.
Yeah, I think the question about the wards, and I think now today when I teach clinical research in young students now, very often I tell them that you can't know clinical research unless you go to a hospital and see how it's running. And the example I give is of KM of our times now. And I think I give example to make them understand that how it can be very complex. No, I remember, no, I think the first time somebody asked us to go to the pathology lab. I mean, I'm telling you this story like a bit of a humor, but the reality is that there were no yellow lines to tell us where to go. I remember somebody said, why don't you go to the ground floor and start walking straight forward? So you see on the right side there were wards, and you go straight forward, you enter the RMO mess. Now you don't want to enter the mess because nobody allows you as a student to enter the mess. No, don't go there. Take a left turn. You take a left turn from ward 1 and you start walking. And when you're walking there, you suddenly get a shock of your life. You're a student of maybe second MBBS. On one side, people are jumping, spitting and shouting. Other side, people are crying. And then you realize after some time that on the right side was the hydrophobia rabies ward. Left side was the psychiatric ward. People were given ECTs that time, so they were shocks. But he said, no, go further. When you continue further, you suddenly enter a place where there are only dead bodies being opened up. And you wonder that is the lab, this is the way they open to do things, lab studies. No, go to first floor. Pathology lab is on the first floor. That was the autopsy room, ground floor. So I said, if you don't know where to go, you tell patient, tum jaake khun deke aao in the lab. I'm not sure where the patient will go if you just let him go like this. Of course, today I think there are enough lines to tell you, take yellow line, take red line, take blue line. But I'm telling people in clinical research that unless you know how your hospital works for a patient, you cannot do quality research. That's why I quote this example very often.
Arushi, can I say something here?
Yes, Ravi, go ahead.
Yeah.
We are the chief.
Now this is a huge thing. What Anil said about our teach. We are what our teachers made us, and they made us what we are by being completely passionate. That is the word that Anil said, and that is what I want to repeat. They would teach us all times, honoraries, full-timers. They taught us how to wash up. The registrars, for example, how to wear gloves, how to stand on which side of the bed and why. They taught us every single thing. Every day of the week, 3 hours we are in the wards. On emergency nights, we are in the ward for 24 hours. We participated in everything and they supported us. And I can remember quotes from each one of them. And I say this in my lectures. And Dr. C.V. Patel, the late Dr. C.V. Patel used to say, boy, God has given 2 hands to compare. Things like that. There was, I forget her name. Now she's in the US now. And who was that, Anil? The 2 ladies, Kalyani and what is the other name? That other lady.
Hina Rajdev.
Yeah, Hina Rajdev. And she was such a brilliant surgeon.
Kalyani Bhuta and Hina Rajdev.
Yeah, Hina Rajdev. And she would quiz us on everything. Stand here, the urine bottle should be on one side, the saline should be on the other side, every single thing. I'm saying this, Anil, you will not believe it. I know for a fact that from senior faculty that students don't go to the ward to attend rounds. There are no cases distributed. There are no exams. There are no case presentation, and this is a fact. And that makes me really sad.
We should a little avoid what it's today and how
I understand, Anil. This is I completely agree. I will stop. But this is something for the students. They have no idea what they are missing by not going to the bedside. And even in lectures in KM, when I take something or other, I say the same thing, but it makes no difference to them. I mean, they have to know that we are what we are because of our teachers and what we learn from patients, not what we learn from books. Anyone else? Anil, you want to say something on this? Learning from patients?
And another word I will like to say is dedication. Not only just passion, but dedication. They will put aside everything else but the teaching, the practice, the medical profession. Suresh, you agree?
Yeah.
Okay.
Very much.
Okay.
Since you are
Anushi?
mentioning dedication, let me just maybe it's continuing today, but I don't remember. I think in second MBBS, first time I think Dr. Karandikar made us prepare and present on topics. So like a training that you must prepare and you must present. Students presenting something on a topic like drugs, to me it was a great opportunity. I mean, I think he was doing something unusual at that time. And I think in that group of pharmacology teachers, we had a variety. Professor UK Shet, I mean, Dr. Anish Sheth's father, if you know his background, he came from pathology, but became a kind of a doyen of clinical pharmacology in India and world over. He used to teach us, and I think his way of teaching was one. Then you say Dr. Amladi. Dr. Amladi used to teach us English more than pharmacology. He would talk about a word and they said it's a question of semantics. And we said, what is the semantics? I mean, those were very new words to us. So Dr. Karandikar, Dr. Amladi, and of course, the others were still younger people that time. But I think I remember, these moments of, early morning lectures, 7:45, very difficult time. But I think that's what, as Ravi put it, although we were probably dowsing and writing notes, but when you open the notes later on, during the exam time, you found that, there were gems in the notes. But we got a lot of history that time of medicine, not only just the pharmacology, because every subject, if you don't know the history and how it's evolved, I think it becomes a dry subject of some time. Yeah.
Okay, Arushi, back. I think we may exceed our
their aim.
time.
And we also knew that this is what going to take place. But whole attitude was, well, let me stand up to that and I will see to it that Dr. Parulkar or Dr. Bapar doesn't get a chance to screw me up. That was the attitude. So it was a biggest attraction of all this was teaching by all these. And they taught us everything. How to stand, how to dress, what to wear, what not to wear. Of course, we were not much fashionable. Ladies wearing a Punjabi dress was called fashion. Bharti always wore sari, frogged. So there was not much fashion during our time. But how to stand, how to talk, they all gave us they were living examples of what to do.
What we liked.
So it was
What we
really
liked
enjoyable. And
Yeah.
Suresh, yes.
What we liked in fashion, we made up in passion.
Anil, I just wanted to.
I was expecting.
Can I just cite one, very famous quote of Dr. Parulkar? I remember during, somebody presenting something and making a mess of it. He said, "Doctor, if you present like this, you will be cut into two pieces, and none of them will be allowed to present the case in the exam. None of the parts will be." We could not understand, but he was trying to tell us that, well, become a better presenter.
Yeah.
Okay, Arushi,
Okay.
can you go a millimeter
going
back?
with-
Can you take that pointer millimeter back?
I think better go forward, Anil. Otherwise,
Okay, forward.
we will
Chalo,
only,
theek hai.
we'll only
Theek hai.
listen to what you are saying. You would rather
attending
concentrate.
emergencies
Sorry.
and
Yeah,
going at night with the residents to the canteen for dinner. And we had one canteen contractor, RMO canteen contractor. His name was, he was always nicknamed Morris. Just like Boys Hostel contractor is always nicknamed Rambai. So Morris, that Morris was a perennial contractor, a permanent contractor of RMO. So go to RMO mess and eat over there as student used to be a great pride. And of course the bills were paid by the seniors. The senior residents we used to call them registrar and housewife. They used to pay the bill. So that was a big attraction for attending emergency. And after attending emergency, the last train was at 1:18 at Elphinstone Road Station. That time, this Prabhadevi station was called Elphinstone Road Station. So we knew the last train, 1:18. So we used to catch that 1:18 train, go sleep for 2-3 hours, and again back at 8 o'clock. I used to stay at Goregaon. So the train, 777 train at Goregaon used to bring me here at 7:42 and 10 minutes walk, 7:52 inside MLT for the lecture. So it was all like a family, pleasure, happiness, passion.
Thank you, sir. Thank you. Uh, we would like to ask you about the important events which took place, then debates, competitions, cultural events.
Important events, we had even that time we had an extremely active RRDD department, still called RRDD, reading room and debating department. Very active. Then all the secretaries of RRDD and one secretary, Khushlani, Manoj Khushlani. I'm sorry, I may be making mistake about the first name. He was our secretary when we were in the first MBBS. So that created an extremely positive and good impression about RRDD. It was really great to attend that. I think it's Manoj Khushlani.
I have not with
We
you
don't-
in first.
First MBBS you were not with me.
Can
I
I,
think
can
we
I,
don't.
can I add something here? It's about RRDD.
Yeah, go ahead. Don't ask, yeah.
They used to arrange debates, and I remember a very fantastic debate where so I'm seeing Dr. Kothari is in picture now. I remember a very fantastic debate between Dr. Kothari on one side and all other surgeons on the other side and other doctors. And Dr. Kothari was telling them that some things you should not do as surgeons. But so there was a big debate, and I remember Dr. Kothari at one point, I'm reflecting, closing his eyes and saying, citing a book, so and so book, page number 600 something on the right side, this is what is mentioned. Now people would say, oh, was he just faking? But if you go and check the book, that would be presented. So what he was quoting was with phenomenal memory, but he was challenging the dogma that time that we must operate, we must do this, we must do very, very aggressive. That's what became his philosophy of life now. Overall, he talked about cancer, but his idea was that can the patient take charge of his own health, rather than doctor becoming, the kind of a judge, jury, and executioner for his health.
Okay, Arushi.
So then my own classmate, Krishna Iyer, became RRDD secretary. And all RRDD secretaries were absolutely wonderful and very active every month. Jaya Baduri was a craze that time. Well, Amitabh Bachchan was not craze at all. Jaya Baduri was craze. And Jaya Baduri was brought to RRDD. And it was, I tell you, such programs used to be fun. Then I myself was secretary of Marathi Vangmay Mandal. And Marathi Vangmay Mandal, we had variety of programs on poetry, on music, to sing. A very active hiking department. I don't know whether it is a department exists. Hiking department.
And you
Every
remember,
Saturday, Sunday used to be a trail to one place or other place.
Arushi, please
you
pause.
remember hearing Dr. Christian Barnard in KM?
Yeah, very much.
I think they might know, but he was a kind of a father of heart transplant, and I think he had come to KM. And I think
First
there was no
person
place to- yeah,
successful heart transplant.
yeah. So there was no place to stand, but I think we were all.
Yeah, absolutely pack MLT. Still in front of my eyes.
Yes.
Very good. Okay, Arushi.
Unfortunately, I never, though I walk a lot, I walk on Sundays, used to walk on Sundays from Goregaon to Jogeshwari, but I never was part of the IQ.
Correct.
We had a
Good
very
used to.
active
Hello, 1 minute.
cultural and it's week, college week.
1 minute. Andheri. Anil.
Yeah.
Good used to stop at Jogeshwari. Otherwise, if you would proceed further, the डोळ्यासमोर अंधेरी आले असते.
Okay, Arushi.
We had a college week. We never had this, what is that festival, youth festival? Avishkar, etc. We never had. We had a college week. And entire, of course, starting with sports, then 2 or 3 days, and this tennis court and basketball court used to be converted into an open theater. And we always had a 3-act Marathi drama. 3-act. And all the senior professors like the Purandares, Dr. Karnik, Dr. Bhalerao, Papad, Parudkar, the dean himself, all will be there and a packed crowd. Now, of course, we had to perform dramas which the crowd enjoyed. So it used to be used mostly comedies. So it was a very different atmosphere. And in the middle of the drama, we used to receive call. Nowadays, I don't know whether they send a call on the book, in a book, written in a book. Call comes from, say, Ward 5. So Ward 5 call will come. Dr. Tendolkar, your patient, bed number 13, requires RT. So please come. Call will come. So that call will be openly read out over there. And so during that time, we'll all face. But that was the flair of the whole 3-act play. In fact, once we had Shakila Banu Bhopali, I don't know whether you have heard. She was a very famous singer, Shakila Banu Bhopali. And she started singing, and then this call came, and she was very furious. ये क्या हो रहा है? हम गा रहे हैं और ये बीच में क्या चल रहा है ऐसा? So
I
it
just
was
mentioned,
very,
Yes,
very-
Arushi.
I just mentioned two things.
Yeah, please. Why
I
two,
think, I
three?
think for some of us got exposed to this excellent singers, especially classical music, Indian classical music, at KEM, because we could never get a chance to go to a concert. We couldn't afford to go to a concert of Pandit Jasraj or Shiv Kumar Sharma, but we saw them live in KEM as part of this College Week celebration.
Yeah,
but-
Vincent also had come.
Yeah. At
Remember
the same
that?
time, I remember something very, very interesting. Since you mentioned Dr. Ravi Bapat, I recollect that, if you don't perform well in College Week, what happens? I think there was some guy, singing or something, but no, very besura. I remember Dr. Ravi Bapat suddenly going to the stage with a coconut and some kind of, shawl kind of thing and saying, ki, ye log coconut aur tum band to kar do yaar, bahut ho gaya. Something he did in public to say that now you stop singing.
Ambi, tell something about fish ponds, no?
Yeah, fish ponds, yes.
You can tell.
I
have
don't
missed
remember.
fish
I don't
ponds.
remember.
I
You
have missed
remember
fish
all sorts
ponds.
of things. If you have a particular example. I mean, I don't
No,
even know if there's
I remember one. I think they took some guy who's looking little bit. No, I mean, I say today there's no problem, third gender kind of thing. So they were saying he thinks he is one of them, she thinks one of them, but they think he's one of them.
Okay.
There was a
another
very sad,
interesting small anecdote.
Stop.
We were performing one drama.
Arushi, stop, please.
and there was another, I think, very fat guy, obese guy. He said, if he lands on the moon will land on us.
No, just 1 minute. 1 minute. Just to tell the news. 1 minute. Can I tell?
Yeah, go ahead.
Yeah, just to tell the present people how old we are. Our anatomy locker fees for 6 months, I still have the receipt, was 1 rupee 25 paise.
Okay.
Now the 25 paise also doesn't exist. Secondly, our tuition fees for 6 months was 250 rupees.
Yes.
And arts and science tuition fees in other colleges used to be 300 rupees. And our tuition fees used to be 250 rupees for 6 months. Hostel used to be 10 rupees. And
Yeah.
all those things.
Yeah.
I still have the 1 rupee 25 paise, the locker fees for 6 months with me, receipt with me.
Great.
That's how old we are.
If you have got a photo of that, you can display right now.
I will.
And you could also mail it to the humanities people. It would be a part of the centennial volume. For any of us who have any memorabilia like this, you should send it to the photograph of that to the humanities volume, and they may find use for it. It's all in the history of GS Medical.
Okay, Arushi.
I think Tarun Turka Matarya Orca is extract. So extracted great extract of poor people versus Tarun Turka, young Turks. That was the drama, very hilarious one. And while I was there along with Chandu Patankar and Mahesh Gosani, and a call was read, and the call was from my own ward and my own patient. The call was not for me. Call was for my junior to come. that patient is having some trouble. And in the middle of the drama, I totally forgot that I am in the drama. I'm performing the drama. I've totally forgot. And I started thinking, why the patient must be having vomiting? So what are the causes? Typical GS style causes of vomiting. Is it gastritis? Is it increased intracranial tension? Is it this? Is it that? And the call was over. Call reading was over. So I was expected to start the drama. And Chantu and Mahesh are telling me, I was a professor in that drama. So they are telling me, sir, chala, sir, tumchi chhatri. And I was lost from the drama. And I was mentally in the ward. And I am thinking that why this patient is having vomiting. So that was a great movement. I totally lost contact.
And our drama is to start at
Our drama is to start at 10:30 p.m.
11.
and is to get over by 4 a.m., 5 a.m. And then between the two acts, all the professors, everyone will come and chat, joke. They used to give us cash prizes. Of course, those days, 100 rupee was a princely sum. So it was all fun. But lots of patient relatives also used to come and sit on the last rows. So we had that college week. Then it's all Avishkar. So we had, and Gujarati drama also, 3 act Gujarati drama.
I remember
English usually 1 act.
I remember something, Anil.
Yeah.
In one such program, I think when the program ended, no, I mean, I won't name it was our teacher, in one of the specialties, he came out and he started looking for his car. For the car was standard Fiat car that time, and the car wasn't there. Now, he was known to be a person, kind of absent-minded. So when he said, my car was here, nobody believed him. No, everybody was laughing here and there, all students laughing. He's saying, but car idhar hi tha, idhar hi tha. Nobody believes him. Apparently, he had to go home, nothing could be done. Next day, we realized that some students had opened the car somehow, managed to drive the car almost in Mumbai, some 100 kilometers and come back next day, kept the car back in Kenya. So he was right about the car, but nobody believed him because he was supposed to be absent-minded.
Okay, Arushi.
Play and Hindi 1 act. And those days, so TV had just come. I'm very awfully sorry. So TV had just come to India. So we used to make a lot of calculation and see to it that our drama is not on Chaya Git Day. There was one program called Chaya Git, where they used to play all the songs from movies. Chaya Git. So it was a big crowd puller. So we used to ensure we had to do all calculation. So Marathi 3-act play will see to it that Chaya Git is on Gujarati 3-act play. It's not habit or some calculations we used to do. But I'm very proud that except 1971 or perhaps 72, all the other 3-act plays were directed by our own students. And I will like to take name of Chandu Patankar. He was professor of course, that time he was not professor of microbiology. Well, later on he became professor of microbiology. So we started directing our own. We used to take part in intercollegiate 1-act play competition. Marathi. And I don't know whether you have heard the name of Anand Nadkarni. He's a psychiatrist. 5 years junior to me. 1976 batch. He used to write. Right. Chandu used to direct. And Mahesh Gosavi, Uma Date, Batavdekar, Manoj Batavdekar, consecutive 3 years, I may be wrong, maybe even 5 years, consecutive. Best drama, best writing, best direction, best stuff. No outside, Atmanirbhar. Yeah. So it's a great achievement. At one end, you are the top of the cream in the medical, and other end you are, and believe me, I can tell Anand Nadkarni in 1980s, again I may be wrong by a couple of years, that time he handled the topics like homosexualities, leprosy, in a very decent manner. His Swanat name was partner.
I think Anand's book is quite popular, no? He's more like autobiography, no?
Yeah. But as a student that time or resident, he handled all these topics.
Yes,
This is what is great about him.
That's
I
true.
feel great even today. Okay, Arushi.
Leprosy was certainly over. More is blossomed. Certainly, I mean, totally withered, wilted. So those days he handled such topics. Really appreciate something. You have to appreciate. And all acting, direction, everything by GS students. We never called anyone from outside. And in the same line, originally, one group was started called Orgy, Orchestra of GS Youngsters. Everybody was GSI, no outsider, no outside instrument player. Shishir Thrower, I might have forgotten some names I may not remember it correct quickly, but what I want to tell that everything we did. So that is something great, I feel, which these moments I cherish. See, you call somebody from outside to sing, and entire orchestra is outsiders, and only Anil Tendulkar comes and sings is different. Here the orchestra, the singer, the director, music director, choreo, everyone is GSIs or G. So that has to be appreciated. These two great things happened in culture, even today I remember. And same thing continued in 1995 or 94. I don't know. A student wrote a drama, Abhanga Prabhu. And that won the best drama, the director, and best writing. In a very prestigious event called Unmesh. Unmesh is exuberance, enthusiasm. 1995, not very long back. You might have heard the name of Abhanga Prabhu. He runs very popular pre-medical coaching classes. Now so this is what I remember from cultural activity.
Arushi,
On the sports side,
Yeah, Ravi.
What Anil has been saying so far in the last 10-15 minutes is all humanities. Without calling them humanities, and in those years, 30-40 years back, we were deeply involved. And Anil was one of the prime movers of this whole thing. Bharti was also there. Humanities was an integral part of our education at that time in a very, very big measure. As Anil said, everything was done by GSI. Orgy was a great, unbelievable hit. It was across in one of the halls on the main road, but that was cultural event beyond imagination. So it's very interesting that now we talk of humanities and get everything together, which is a good thing, but that those days, it was in our blood, in GS blood, the college week, the cultural events, the orgy, it was all there. I mean, the teachers participated wholeheartedly. Like he said, first day, first row, they are teaching, sitting and putting us on to more and more work. So it's interesting. And I think students should know this, that it was there at that time. And students work in humanities in a different way. There are contests, there is painting competition, they do it differently, but we had it without calling it humanity. The other thing, Anil, I have to tell now is that we have crossed 1 hour of this program.
Yes, that's
More
right.
than half of your interviews left. Now, Arushi, you have to decide. You decide. We won't feel offended. You decide how you want to take this further. And I don't know what time limit you have. You can do what you want. Anil, is that right? If you have-
Perfect.
Yeah, but
don't
I think
want to-
Ravi,
We don't
I
want
can,
to create trouble by any other means.
no, we
And,
should stop by
also-
7:15, but I don't have any time to spare before that, beyond that. So I think I can give. to
Also,
7:15.
Anil, it is important now that if you feel that there are important parts of your interview here, we can fast forward. So
No,
you
I-
and Arushi decide.
I have forgotten because
No,
it was more of a chat, less of any talk.
no, but I think just to be.
We can stop, no problem.
Yeah, just to be a little bit, critical that we didn't expect that only Anil will talk to us. We wanted to talk to each other rather, no? So it's a bit of a, kind of a.
It's okay. No, that
No,
we
let
can
me-
arrange
Let
afterwards.
me clarify, Arun. I had put up in the group and nobody responded. So I told them.
No,
actually-
I'm not saying that. I'm not saying what you did is
Actually,
fine.
Nicholas Antao was in charge.
No, Anil. I'm
Was
saying
or
that-
he's still in charge.
No, today's program, I'm saying today's program, I thought we would talk, but it's
Yeah,
like-
I also thought the same. I also
Yeah.
thought the same.
Yeah, so I mean, what today's program, that you did is fine.
But Ravi will agree that I allowed you people to talk. I did not hog all the time.
Anil, you are a good boy. Nalla payyan.
So that's why I would rather go to next important questions and know what we can contribute now. Because if you again go into what Anil is saying, it's very interesting to me as a friend, but unfortunately I cannot contribute much and the time is left. So 7:15 is my cutoff for whatever reasons.
Okay, Arushi, what you decide? Or you want to ask Natarajan sir? You want to stop? It is 1 hour 15 minutes. Arushi, are you there?
Yeah, she's there, yes.
Arushi is sleeping.
Sir,
Good.
we can continue. So if it exceeds 1 hour, we can do the editing later on. But if you all wish, we can continue. That's not a problem.
I have no objection.
No, we would rather ask, we would rather put out
Best
the
thing
other
will be,
questions
Arushi, do you have those questions with you right now,
where we can contribute because
which you asked me? Arushi,
Arushi, the danger of editing is that it may not give the sense
Arushi
of
or
what
Muskan?
we feel.
do you have those questions?
Yes, sir, we have them.
So you can ask these gentlemen, 3 gentlemen, same questions. You can delete my interview. Yeah, perfect. You can ask these. One question was, which was your favorite hangout place in GS?
Irani Cafe. The Irani Cafe outside the KM.
And Katta?
Irani Cafe outside the KM.
What about Katta? Katta?
Katta, that is inside the KM. No?
Okay. Sahyadri?
Sehadriya, Misal Pav. No, Misal Pav.
Milan for chai?
Yeah. And
No,
then
no.
Mahendra's chai wala.
Perfect. I also
think-
remembered.
I want to tell you about a very important aspect. Library was, I think, one of the hangout place because we had to be there. And I recollect, maybe I want to remember this because Dr. Kulkarni was, our teacher in biochemistry and also happens to be father of one of our classmates. He was editing the journal for KM Hospital. I used to see him religiously going to library and looking out. Today you have no Google Scholar, PubMed, all that online. But he would go to each and every corner, find out the journal and check the reference which was to be published in the article. No, do a manual check. So I learned from him that no, you can't trust the article and the references. You have to check yourself. So I learned some lessons of what I am doing today as an editor. That my eyes go straight to the citations, and I start checking that are they doing the right citation or are they just cooking up something. No. So library was a great place to be to understand how one can become a successful writer, not just a reader.
Yeah, I agree with what Anil says. If you have some important questions, you just ask, we will answer, and that way you get a sense of what we feel. Arushi, are you there?
Arushi, Muskan, are you
There.
ready with those questions?
Yes, there was one more question that I had asked. So, was there any specific reason for you to choose the medical profession? And also, was there any specific reason for you to choose St. GS Medical College?
Yeah, but divided by 60. No? The total, if it is divided by 60,
What is
if the
that?
percentage is above 60, you go to medical.
No, I think maybe let's be a little serious. I think for some of us, no.
Just for record purpose, highest is to be 82%. So if you say 60%, they will be suspicious of our IQ. The highest Pramod Lele in our class was 82%. I was fifth on 77%. 77.01. I remember.
Okay,
No, but
Anil,
That
everybody.
was the percentage. No, if you say 60, Arushi will think, "Sala, kya level ka aadmi aa gaya apna."
Yeah, but Anil, say, why are you going to that percentage? She's asking you, why did you want to become a doctor? See, I mean, that was
Anil, why did you want to become a doctor? I have to tell. Nobody knows so far.
but
Nobody knows, yeah.
But
so in I mean, the way of selection was very easy at that time. So I had appeared for the IIT entrance exam after the first year, and I wanted to be an engineer. Those who know me, what I do now, maybe that's why I wanted to be an orthopedic surgeon or radiologist. So I wanted to be an engineer. So in IIT, I had got selected for mechanical engineering in Kharagpur. But by that time, I was fascinated with dissection. And so I say what made me get into medicine is the dissection of the neural ring of the earthworm. All of you remember the neural ring of the earthworm?
Yeah.
So,
And cockroach also.
You have to take out that intestine from that ring without taking the ring.
Anil, I don't remember the name of the demonstrator in Ruya, but she said, you have done a brilliant job or whatever. So that dissection, the love for dissection is what made me a doctor. So I gave up that Kharagpur seat, and I studied very hard. And I got 66 point something %. I was 120th in the merit list. And I was delighted that I got GS. I was not a great student, like some of the tops in our batch, but I was so happy that I got GS because everybody said GS is the best. So I came to GS Medical College. But earthworm, neural ring, Ravi Ramakantan becomes a doctor.
I think
Yes, Arun.
in my case, see, I think those days, I think the choice was clear. You have an A group and B group. And obviously, if you are from middle class, you want to become either, as you said, an engineer or doctor. I want to become a doctor just because it was a good life in terms of earning enough money to have a good life. But coming back to the second question, why KEM is very interesting. So I remember when they asked in the interview, I mean, incidentally, I was 8th on the list after you, not 5th, but I was 8th. I was 76%. But anyway, that's apart. So I remember when you went to the panel of interviews, they would ask, oh, which hospital do you want to KM? Which one do you want to go? So I said KM hospital. I said, but you are saying Parla, no, Ryan is closer to you because in those days, KM was number 1, Nair was number 2, Sion was number 3, and obviously KM, JJ became kind of competing colleges. So Sion, they wanted to get good students. So they were kind of saying, but why don't you go to Sion? It's closer to your house. I had to convince them, no, so it's not closer to my house. If I come by train, only Parla to Elphiston, acha hai, no. I had to do a lot of jugglery to say I want to go to KM. They were very keen to put me into Sion. I said, no, sir. I mean, I nothing against Sion. Sion is a good place because I think Anil has been there. So I'm not, but I think those days, KM and Sion, no, and Nair, we as you said, no, Ravi, we were happy to be getting into KM. Obviously, and 80 of us came from, I think Jahin, many came from Rohia, the other half was from Rohia, and there were a few others. I can tell you that 80 out of 160 was like almost more than almost 140 were from these two places, and then there were 20 from other places. So we had a good kind of group gathering of people coming together. And Anil mentioned when you used to go from the station to KM, Elphiston, virtually I think the Western Railway people used to kind of block the whole road. So we were almost so many walking towards KM.
Yeah.
In my case, hello.
Yeah.
In my case, yeah. In my case, I wanted to become a chemical engineer, and I got into IIT also. I had appeared for IIT, and I got into IIT. But my father said, nothing doing. You have to become a doctor. म्हणजे काय? He prevented me from going to the interview also. म्हणजे this IIT interview, he said, no, nothing doing. You have to become a doctor. So I said, now see, I have already got. Another thing now in inter-science, suppose I don't get, then this will also go and that will also go. He said, no, nothing doing. You have to become means you have to become. So that way I landed up in medicine. And then it was like GS was the best. So it landed up in GS. So that way, not by chance, but then I started loving it. That is another thing. Because if you don't get love marriage, you get marriage after love after marriage, or marriage after love, whatever it is.
These are the photos I have given related to our college events.
Yeah, fine. I think we have seen some of them. Yes.
This had come in our group.
Yeah, sure. Yes.
Yeah. Next one. Over. Questions? Muskan?
The participants are slowly going down from 10 to 8 to 7.
Yes, sir. One last question.
Yeah, last question. You can
What is your message for the future medical
students.
students?
You can delete these photos and you can ask all these three. I had said that be passionate, love your work, so there won't be any stress. So simple.
My message, 1 minute. My message to youngsters is always listen to your father.
No, I would say a different message. You know, I mean, see, we talk about, as Ravi put it, no, the word humanity was not there. But I can tell you personally, I mean, I became a doctor is one part, but being in KEM, I met so many people with varied interests. I don't call them brilliant or intelligent. That's a kind of, not a word to talk about for KEM people. But excellence is one part. Culture is one part. For example, Indian classical music, I got into it because of my friends, like Rajiv Soman, Hemant Ratnaparty. We would listen to it. I'm not an expert, but I enjoy that music. Then this debates and reading, so you become communicator, elocution, and obviously you meet very great teachers, so you become more than the patient. I think the empathy was there in some way. I can recollect. I think a very simple incident. That once I remember I telling the patient in the ward that he wouldn't go home. And in KM you can't tell people to go home because there is no place. So one day he said, "Sir, in Marathi, मला जायचंय घर और माझ्याकडे ₹1 नाही. बस का ₹1 मेरे पास नहीं है." Now that was something, and I could give him ₹1 as a houseman or something, which was to me a great thing which I could do. And I could see it on his face, he was very happy कि किसी ने ₹1 दिया और मैं घर कर सकता. So these things, small things, which are there, which I think you can't take out. So as the other day I put in our group that you can take yourself physically out of KEM, but you can't take KEM out of you. So that's where I can just sum up that. That's what I've become a better human being by going to a place like KEM, where you had this variety of interest, variety of thoughts, and obviously still teaching, learning became still the fundamental thing. We never kind of sacrificed there or compromised there.
Arun, the question was, what is your message for this new generation? In 2 sentences.
I think they have to, as Ravi put it, the problem is now that they are first looking at as MRI and then looking at the patient. Maybe nothing wrong with that, but I think they still have to, I think, maintain the qualities which are required. I don't mind somebody looking at CT scan, but then when they talk to me, can they be patient about what my questions are? Can they tell me what has happened to me? What are my options? Because today what happens after CT scan, he says go to the OT. It shouldn't happen. Why my scan was done? What are you showing me? So why should I go to OT straight away for surgery? So the communication part is becoming more and more difficult because everybody has technology. You are rushing into it. So technology with balance of humanity and obviously ethics has changed tremendously because today I think every patient is worried about going to a doctor. The trust is almost gone. Now building trust would be required, and that requires effort. I don't think we all can do it, but individually I should be able to do it in my patients. For example, today, no, I'm in a smaller city, and I went to a doctor, a physician. He said, we don't have any problem of the kind you have in Mumbai of patients trying to attack us, because we have a good communication and trust. Now that small city consultants kind of virtue will be part of a virtue of the future generation. We would still be able to get great doctors, great researchers, great innovators.
Ravi?
Yeah, I have one line
Yeah,
advice to patients. I rarely say advice, but this is advice.
students, advice.
To the student, advice to student. Therefore, I'm using the word advice. Go to the wards, learn from your patients. You will never learn medicine this way after you finish MBBS. You have to become a doctor by learning from patients, not from books. That's all.
Okay, Arushi, thank you very much.
Yes, sir.
Thank you so much, sir, for the valuable advice. I would just like to conclude the session by giving my vote of thanks to our Dean, Dr. Sangeeta Rawat, and Academic Dean for support. We would also like to thank the Gosumec Alumni Association for the administrative support for correspondence and for financial transactions of Dr. M.V.L.Kothari, Chair of Medical Humanities. Last but not the least, I would like to thank the entire team of Medical Humanities, Mr. Tushar and Mr. Badal for technical support, and Mr. Mhatre for video recording.
I thank my friends, and let me tell them that actually we meet each other on WhatsApp, not just once on a day, but 10 times in a day. But again, it is simply enthralling to see Ravi, Arun, and Suresh Khilari. It's just it is romanchit houn jato लगेच. It is real happiness to see you.
Thank you.
See you all. Okay, thank you very much.
Thank you.
Thank you, Arushi. Thank you, Muskan, and thank you everybody who are behind the scene. Thank you very much.
Thank
God
you.
bless you.
Thank you.
Okay, thank you. Good night.
Thank you so much.
I'm logging
Good
out.
night.
Good day.
Good night.